Michigan. So I have just completed an explant on a nice lady, 65 years of age, out of state. She comes to me with a set of implants, silicone, that she had in 1990. So these are 34-year-old set of implants below the muscle. So as you will see, 100% total capsulectomy has been done. As you will see, let's go ahead and start off on the right side. This was done in en bloc fashion. I cut out the scar, as you can see right here. This really helps with the contouring. If I go in, you can see this is some inflamed tissue that I removed. It does not look normal. It is very hard, indurated, thickened. And so this was exactly how the implant was sitting underneath the muscle. And as I go in and I flip, look over here. This is, believe it or not, cartilage. Cartilage off of the rib. Cartilage off of the rib. Cartilage off of the rib. If I go hold it, this is cartilage. It's cartilage. So this is an imprint of the cartilage. If you can imagine, these are the ribs. The implant was sitting right like so on the midline part. And so I literally dissected this off. And in order for me to completely remove the capsule and remove it en bloc such that none of the silicone spills, that cartilage has to come off as well, in order for me to ensure all of the capsule is removed, and in order for me to not go into the capsule as well. So as you'll see, some areas are relatively very thin, some areas thick. And so I'm going to actually go in from here in between, because this is the very tedious part. As you can see, look, it's almost transparent. So as I go in, these are 34-year-old. The moment I talked to her on the phone, I said these are ruptured till proven otherwise, and 99.9%, just from the fact that they are this long, they are ruptured. They're not lifetime devices, as we all know. So as I go in, you can see, look how thin the capsule is right here. Done en bloc. As I go in, look at this, how thin this is. It doesn't take much to go in, and you can see, look at this ruptured implant, and I'm right in between the ribs, if you will. Very hard, and none of this spilled into the chest. And I want to show you again at the back of this. This is the rib right here, the rib. You can see the carvings of the rib. Now, some patients will ask, well, is it not a problem for the patient? Absolutely not. You know, we remove ribs to reconstruct the nose, you know, on like even 10-year-old kid, for example. This has been done and reported. So as you can see, look at this slime, and let's see the inside of this. You can see the calcifications, and you can see some areas so thin. You can see my glove right here. It's transparent. If I take the ruler, and I'm just gonna show. If I take the ruler and look, you can see the numbers clearly marked, like number 8, for example. So very thin. No matter how thin, you want to have it all contained. Someone challenged me last week and said, why do you have to do en bloc? I said, this is the reason why you do en bloc. So all of this capsular tissue is removed. And you will see, look at this calcifications. They're very razor sharp. All of this has been removed, and this will be going to pathology. And again, look at the back of this. You can see my blue glove. All done en bloc, gold standard. You can see these islands of calcifications. And clearly, as you will see right here, molten lava, if you will. Just if I let go, it will drip onto the side. So as you can see, implants are not safe. You don't want this to spill into the chest. And this is where the cartilage becomes key in order to remove. So what I'm going to do is I'm going to go ahead and change my gloves. I got some sterile gloves underneath. So in the meantime, the con procedure, the capsules are always sent to pathology. The cultures for microbiology, aerobic, anaerobic, and fungal. No drains, no lift. This is not the time to be doing a lift on this 65-year-old. And I'll tell you, she's doing relatively very well for someone who's 65. Given her presentation, she will very likely not need a lift. And I can tell that. Deep sedation with twilight, propofol, fentanyl, Versed. High definition pictures and videos sent and given to the patient if she wants. Of the chest wall, showing that the entire capsule was removed. Implants are always returned to the patient. And then the same surgery is offered to all patients, be it the 22-year-old, 65-year-old, any comorbidities. The patient is basically worked up and the clearance is granted. Now I'm going to go to the left side. Again, I removed the excess skin that really helps with the contouring. Now what's interesting is you can see, look at the way it's sitting. It's like elongated, and this is 100% total capsulectomy. As I go in, We'll see what it looks like. It has that irregularity, and as I go in, look how thin the capsule is. You can see my scissor. So lo and behold, this is indeed very much intact. Now look at this. Very interesting. Look at the color of this. And overall, this is an intact implant. It says Silastic, 350 cc's. And this is what I will call an intact implant. Now, if I go to the back of it, you can see some stickiness right here. It's very subtle, but you can see this is your gel bleed that's slowly occurring. Now, an intact implant, 350 Silastic. These are the older models. Remember, 2 years after she got them, there was the ban on the implant. So, very happy and content with how the whole dissection has gone. And look at the calcifications on the inside. This is what I was pointing to earlier. They're going to snap. And so, complete removal of the entire implant capsule and all inflamed tissue. So, as you will see, the capsules will be sent to pathology, rule out the BIA, ALCL, rule out malignancy, rule out any abnormal pathology, rule out squamous cell cancer, rule out breast cancer. Cultures for aerobic, anaerobic, and fungal implants will be returned to the patient so she can see, and there is a psychological closure that the implants were removed, certainly in the standard en bloc manner, especially on the right side, such that there is no spillage of the silicone into the chest, no need for drains, no need for lift. And one has to always assume they are ruptured till proven otherwise, because you don't want to go in. We have a patient today, she had her implants just 9 years and from 2015, and the next thing you know, her surgeon was assuming that the implant was intact, and it turned out that the left side was ruptured, and now there is a major catastrophe to manage. And then we will see, most importantly, how the patient bounces back. You can only imagine the amount of, quote, reaction that this ruptured implant is causing on the right side. She had a contracture on the right side that was giving her a lot of misery and grief, as you can imagine. Nice nurse from the Midwest, and again, I could not be happier with how the whole surgery went. Blood loss was 5 cc's on each side, a total of 10 cc's, and there you have it. This is Dr. Khan, Executive Plastic Surgery.